Thank you for joining us for today's session. I'm your host, Danielle Fuentes Johnson with the Build Initiative. We would like to begin with a land acknowledgement from Giovanna Archuleta, Assistant Secretary for the New Mexico Early Childhood Education and Care Department.
I would like to open up this meeting acknowledging our Mother Earth and the land she nurtures us with, the land where our children grow, and the land that provides the food to feed them. When we talk about these resources, we must also acknowledge the lands of our tribal people and the deep spiritual and long-standing relationship of all tribal nations. Today I come from you from Nambe Winge, the land of my ancestors who cared for it and fought for it so that I may one day live and raise my own children on it. A relationship that predates colonial contact by thousands of years. Our ancestors still speak to us and guide us through our songs, ceremonies, and writings. Through removal, trail of tears, long walks, assimilation, and the idea that by removing children would kill a culture. Our ancestors did not give up. Our tribal people are some of the most resilient people in our country, continuing to raise children to be resilient, who are nurtured through language and culture, the language and culture that cannot be removed. We must also acknowledge all other spirits who were forcefully displaced from their homelands and trafficked for labor and production on sacred native land. All of us collectively continue to experience the adversity that's caused our ancestors and spirits who continue to hurt from actions done to them. Take a moment to pray these people find the healing and peace to raise their children in a world that has so many opportunities, but most importantly, create coexistence free of violence. Tribal people are praying people. This is where we are all tied. Our grandmothers and mothers continue to pray over us. And as tribal people pray, they pray for people in the north, in the east, in the south, and the west. They pray for infants, children, adults, and elders, and our non-human relations, each with knowledge to share with us. As this conference begins, I hope that each of you are balanced in all directions and take a moment to appreciate what Mother Earth has given to us and how she continues to nurture us in many ways. I invite and encourage you to learn who are the original stewards of the land you live and work on and support those nations and children of those lands. Thank you.
The Build team is excited to present this 20 webinars in 20 days for QRIS 2020. Explore ideas, possibilities, and learn together about how we may recreate better, more equitable systems with children, families, and early childhood professionals at the center of our efforts. We're grateful to the many individuals who took time to prepare sessions, generate content, and share ideas. We believe the sessions will inspire you to build on these ideas, continue conversations, and innovate back in your own communities and states. We have learned a great deal as we prepared for this virtual event. One of our lessons is that a virtual event draws a much broader audience than an in-person conference. The Build QRIS conference was designed for early childhood systems leaders at the national, state, territory, tribal nation, and community levels. As registration rolled in for the event, we discovered many direct service providers, from teachers to center directors and home-based providers, signing up for the sessions. We welcome you to our learning community and look forward to hearing your perspective. We encourage you to please share your comments, ideas, questions in the chat box. As you know, we had to pivot from our in-person conference to a virtual conference. We would like to say a sincere thank you to our sponsors who made that switch possible. Their support is essential to this event. We have all become familiar with the Zoom platform over the past few months as we've used it to connect with our friends, family, community, and colleagues. We want to point out a few features that still may be new to you. First, when the PowerPoint isn't showing, you can choose your view. In the upper right-hand corner, click on speaker view to see the active speaker, or click on gallery view to see everyone. Next, we encourage you to provide feedback throughout the session by clicking participants to open the participant list, and then clicking at the icons at the bottom to respond to questions to give us a thumbs up. Presenters may also use this feedback for some quick polling, so be ready. We encourage you also to be active participants in this session. Please share your experiences and questions in the chat box. If there are polls in this session, a box will pop up on your screen, and we encourage you to respond. This helps us generate more conversation and enhances our learning together. Now, I would like to turn it over to Cynthia Tate to introduce our presenters and launch our session. Have a great session.
Thank you, Danielle, and welcome everybody to our session on young children and child welfare in times of COVID. And we want to thank you for joining us and spending this time with us. We've planned a really informative and jam-packed session for you. So we hope that we're going to be able to really share information with you that you're going to find useful as well. And so I'm going to begin by introducing our two key speakers. We have two additional speakers later on that Marlo wants to introduce, but I want to introduce to you Marlo Nash, who is the National Director of Partnerships and Policy at St. Francis Ministries. Marlo is a policy advocacy and systems strategist whose career includes executive leadership roles in national and state nonprofit child advocacy networks, including leading the United Way of America's National Success by Six initiative in the early 2000s, and helping to write and pass a significant national child welfare reform bill, the Federal Families First Prevention Services Act of 2018, during her time with the Alliance for Strong Families and Communities. Marlo, welcome, and thank you for being a presenter with us today. Our next presenter is Lee Johnson, who is a senior policy analyst on infant and early childhood mental health for 0 to 3. Lee is a national leader on infant and toddler policy and program development. At 0 to 3, he works in partnership with the Director of Infant and Early Childhood Mental Health Strategy, along with federal policy, state policy, and advocacy leadership staff, contributing to the overall work of the 0 to 3 Policy Center. Previously, Lee served as Director of the Office of Early Learning and Family Support at the Alabama Department of Early Childhood Education. Lee, thank you and welcome. So we will just get right to it.
All right, thank you,
Hello.
Cynthia, and thank you to the BUILD team for including this topic in the 20 webinars in 20 days series. I'd like to start by sharing the basic theme of my presentation. Early childhood system leaders and advocates need to include the child welfare system as a part of the early childhood system and design comprehensive plans, strategies, practices, and advocacy agendas with this in mind. I'd like to ask you to consider the term child and family well-being system of care to describe an approach that brings the child welfare system into the definition of a comprehensive early childhood system. The systems we are talking about are in place to achieve a function. To talk a little bit more about that, I want to introduce the concept of a performance moment. A performance moment is a snapshot in time that indicates that much has effectively been at work to achieve the intended result, as you'll see on the next slide. We are familiar with performance moments in popular culture, in daily lives, and in our work as systems change leaders. So on the next slide, you see a performance moment that's common for many of us. When you place your online order for your multi-ingredient, multi-instruction coffee drink, there's a performance moment that happens when you walk into the coffee shop and pick up your drink and walk out. Many systems operated as intended to make that moment happen. Coffee plant growing systems, coffee bean purchasing, shipping and delivering of goods, baristas trained to make recipes chefs have created, stored employee uniform design, technology for placing the order, making the scale, and you can think, if you really unpack it, you can think a while on that in many systems. There are a vast number of systems and the people who run them involved to put your exact drink order into your hands. So the next slide shows a performance moment that many of us have devoted our careers to achieving. These are kindergartners who are playing and learning. They are confident, happy, and healthy. And just outside the frame, you can imagine a team of teachers who are devoted to helping these children continue to learn. Multiple systems have been involved, including their family system. Maybe their family had smooth sailing throughout their early years. Maybe some of their families weathered through life storms and came out in good shape on the other side. Maybe they even benefited from programs we care about, like home visiting and high-quality childcare. A health system was involved, social systems of family, friends, and neighbors, likely early childhood care and education providers, even an economic system that employed one or both of their parents. A number of systems were in play to make this performance moment happen. So if there are positive performance moments, as you can see on the next slide, there can also be negative performance moments, which is a snapshot in time that indicates that there was a breakdown or gap. So on the next slide, you see the example of a negative performance moment. 41% of the nation's confirmed cases of maltreatment occur for children ages 0 to 4. As a negative performance moment, this indicates that there are many young children and families who are not benefiting from the early childhood programs and supports that we all advocate for. When there is a confirmed case of child maltreatment, it means that the child has been severely neglected or harmed. Our babies, our toddlers, and our preschoolers are literally being emotionally and physically harmed because of broken economic systems and underfunded systems and programs, including those in the early childhood and primary prevention systems that could improve families' lives. Because we know that neglect is the cause of most confirmed cases of child maltreatment, it's about 3 out of 4. We know that this negative performance moment indicates that many parents of young children are exposed to the stressors that lead to maltreatment. These parents do not have adequate support from systems, communities, and political will to eliminate or mitigate those stressors, and the COVID pandemic is making a bad situation even worse. So on the next slide, you see an infographic that's labeled the Hidden Early Childhood System to strongly suggest that early childhood system leaders need to see the child welfare system as one of the systems that is in play in the lives of too many young children and their families. If young children and families are ignored or siloed away once they enter the child welfare system, then efforts to ensure that all young children and their families are safe, secure, healthy, and well will never be fully successful. Let's focus in on 3 of the factoids on this infographic. First, look to the upper left quadrant. There are staggering racial injustices in the child welfare system. And let me be clear, these racial injustices are the result of racism and racist policies and practices. 53% of African American children will be investigated by the child protection system before age 18, compared to 30% of all children. Let's think first about that 30%, and let me emphasize what it means. The National Institutes of Health found that 37% of all children in the United States will have experienced a negative situation that was bad enough that someone felt it needed to be investigated. That's more than 1/3 of our children. And for African American children, more than half will experience that. The difference for African American children that we see in that statistic is a result of systemic and societal anti-Black racism that has centuries-old roots. All of us must be working to address this systemic racism, even if you've never thought about it or if you've never worked on it before. Now is the time. The 2 other factoids I will call your attention to to offer further clues about how focused efforts to change these statistics could make a huge difference for children and families are first, the one I already referenced. I mentioned that the majority of child maltreatment cases are neglect, not abuse. And you can see in the bottom middle of the infographic that for young children, 68% of confirmed cases of maltreatment are due to neglect. Often this is preventable neglect. Second, in the bottom right-hand corner, you can see that a majority of child maltreatment cases involve substance use disorders. For young children, 46% of them are in the child welfare system due to their parents' often treatable struggle with alcohol or drugs. So on the next slide, you see that there is a very important way to think about what is going on when a child is suffering from maltreatment. We must shift away from blaming the parents and towards recognizing that there are preventable or treatable adversities that cause stress for parents that can lead to young child maltreatment. If it requires a shift in your thinking, I urge you to shift your thinking. This graphic, the pair of aces tree, shows that those adversities or stressors are sometimes individual and family situations, often referred to as adverse childhood experiences, that can cause stress that lead to maltreatment. You see them at the top of the tree. Conditions like maternal depression, substance use disorders, or maybe a parent who herself experienced abuse or neglect as a child. At the bottom, in the roots, as in root causes, you see that there are also community stressors like unemployment, poverty, and racial discrimination. So to revisit the negative performance moment of substantiated maltreatment for young children, it is an indicator of multiple systems that are not working in the way that we want them to. Mental, behavioral, and physical health care, the structure of our economic system that allows so many families to live in poverty, the system of supports for working and non-working parents, the housing and market and systems that are supposed to keep communities safe, and even early childhood systems. We know that a great deal of young child maltreatment can be prevented. We know that when it is not prevented, too many young children and their families become involved in the child welfare system. And we know that when young children become involved in the child welfare system, very often their distinct developmental needs are not addressed by the system because it's not designed to address them necessarily. As we have this conversation in today's context, with the COVID pandemic impacting everyone in the United States and to an even greater degree people of color, it is not hard to imagine that even more young children and families could end up becoming involved with the child welfare system just because of COVID-caused stressors. The COVID pandemic is laying bare how woefully inadequate our systems and responses already were with regard to addressing these stressors. There's great concern that the pandemic is increasing and exacerbating the adversities shown here on the pair of aces tree. Those family and community conditions are the ones that early childhood and primary prevention systems, leaders, and advocates are working to prevent or address. They are the conditions that child welfare leaders and advocates are working to mitigate and heal. And they are the conditions and adversities that many families live with every day, and even more so because of the pandemic. On the next slide, you see a graph that shows the percentages of confirmed cases of abuse and neglect by age. The 0 to 4 age group is the line at the 40% point on the graph. Now is the time for early childhood and child welfare systems to be integrated, and the time for their leaders to come together and work effectively to dramatically reduce the numbers of young children coming into the child welfare system, so that the future, like the dotted arrow on this graph, shows a downward trend.
Thank you, Marlo. I want to appreciate on behalf of everybody listening, hopefully, we're really making very clear what the real challenge is with young children and child welfare. And now, Lee, we'd like to go to you, and maybe you could start by telling us a little bit about what the brain science says about young children, also addressing the issues around racial equity in young children relative to their vulnerabilities and stressors. So we can move to our next slide, and Lee can go on and get started there. Thanks. Thank you.
Thank you so much, Cynthia, and thank you so much, Build, for the opportunity. And I just want to acknowledge the moment that we are living in right now. Of course, as we are having conversations about COVID-19, we are also finding that we're having conversations about race, and into Cynthia's point about talking about racial equity, which I will get to and in my portion of the presentation. I also wanted to piggyback off of Marlo's point about the impacts that these kind of childhood experiences related to the impact of racism, as well as COVID-19, and how families are orienting themselves to the child welfare system in these times, and these kinds of experience can have on infants and toddlers. So what does the brain science tell us about young children? Well, before we discuss what many of us may already be familiar with, I want to reiterate that nearly 132,000 children ages 0 to 3 were in foster care in fiscal year 2018, which constituted around 30% of the total foster care population. Like my colleagues shared on their previous slide, infants and toddlers are twice as likely to enter foster care as older children. And in fact, in fiscal year 2017, the specific rate of foster care entry for infants and toddlers ages birth to 3 was 6.6 per 1,000 children, as compared to a rate of entry of 2.8 per 1,000 for children ages 4 to 17. Now, this is important since we know that the earliest years of life are a uniquely sensitive developmental period of rapid brain development and growth. And brain science explains for us why the first 1,000 days of life matters so much for children's development. 85% of the brain develops by the age of 3, and 92% develop by the age of 5. And so we acknowledge that brains are being built during this critical time of growth. A baby is born with just about all 100 billion brain cells, but they're very poorly connected. When we're born, we don't have very many synapses connecting these brain cells. So those connections are created at a rate of 1 million per second, starting at birth, through the process of wiring the brain. But that wiring doesn't just happen. Those synapses are created by and through an interaction with caregivers, where more is happening in the years from birth to age 3 than any other period of human life. Now, the first 5 years lay the foundation for everything that follows, and that foundation can be sturdy or fragile depending on the child's experiences and even more their environment. And further, amid the pandemic, these foundations for development are being challenged, as well as our own ability to self-regulate and co-regulate with our children in these times. Next slide. So, like I mentioned before, we know that experiences in early childhood influence children's brain development and affect their social, emotional, and physical health. Positive experiences promote favorable infant and early childhood mental health, which I will talk about a little bit more. However, negative experiences have adverse effects on brain development. So when I speak about the importance of brain development in young children, it is not lost on me how often the topic surrounding the development of self-regulation comes up. And to the earlier point about brain development, babies aren't born with the ability to control their own reactions and behavior. So self-regulation develops most in the toddler and preschool years, but it also keeps developing right into adulthood. So how important is self-regulation? Well, let's take a look at an adult example. This is a couple of clips from the popular show Family Guy. And in this scene, Stewie, the toddler here, wants some attention from Mom Lois. Though you and I can see that Mom appears to be exhausted. Beginning with the first clip at the top left and panning right, we see just how this interaction goes. So Stewie comes in and says, Mom, 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 Mommy, Mommy, Mom, Mom. And then Lois responds or reacts, what? Stewie pauses and says, hi, laughs and runs away. So as you can see, self-regulation is pretty important. Your ability to self-regulate determines how you react or how you respond to those around you in your care. Now, though this scene is not representative of the current crisis, I am sure you can imagine what this might look like if Lois was instead juggling work-related responsibilities as well, or if she was his foster parent and was simply overwhelmed. So please remember, our ability as adults to self-regulate is predicated also on our early experiences and how those experiences impact us now, which takes us to the next concept. So next slide. So a major premise in supporting early brain development and supporting regulation is understanding infant and early childhood mental health. So what is infant and early childhood mental health, or IECMH? It is the developing capacity of an infant and young child to experience and express their emotions, to form close attachment relationships, to explore their environment, all in the context of family and community. So this concept holds that babies' emotional, social, and cognitive development unfold in the context of relationships. Thus, supporting both the infant and the caregiver is crucial to optimize the young child's functioning. When we talk about infant and early childhood mental health, we are talking about the importance of relationships for the developing child. We recognize that nurturing, responsive, and consistent care is essential to a young child's mental health and forms the foundation for lifelong positive or negative mental health. And furthermore, we acknowledge that the state of an adult's emotional well-being profoundly affects the quality of the infant-caregiver relationship and ultimately the development of the child. Next slide. So thus, it is in this concept of IECMH where clinical professionals speak about a term called ghosts and angels in the nursery. And this term, ghost in the nursery, was developed about 3 decades ago by Selma Freiberg, who was a clinical social worker and child psychoanalyst. And that term refers to the relationship between a parent's early or often negative experience of the way that they were raised and their own parenting style. Now, young children who are abused by their parents can exhibit similar behaviors when they become parents themselves. So often considering the abuse to be viewed as normal because it's how they were raised. These ghosts in the nursery can appear throughout generations, contributing to a cycle of abuse. However, about a decade ago, Dr. Alicia Lieberman and her colleagues proposed the concept of angels in the nursery. And these refer to positive early experiences between a caregiver and child that result in the child developing strong feelings of security and self-confidence. When the child becomes a parent, they can draw on these feelings in order to interrupt the cycle of abuse. Lieberman suggested that uncovering angels is as important to the process of healing with parents who have experienced trauma as is ridding the ghost. The very young child's healthy development depends on predictable, loving, and responsive care. This early nurturing relationship with his or her caregiver supports the child's health and well-being. And in short, a healthy relationship with caregiver in infancy builds a strong foundation for all learning and behavior to come. By contrast, disruption or disturbances of the early attachment relationship due to neglect or abuse, which my colleague Marlo spoke to earlier, can lead to developmental delays or impairments. Moreover, the negative impact of maltreatment or development is exacerbated by the trauma of being removed from the home and placed in foster care, where children may experience multiple placement changes and disruptions in attachment relationships. Without timely access to appropriate supports and services, these early experiences can jeopardize children's long-term social, behavioral, mental health, and health outcomes. Therefore, for infants and toddlers in foster care, an expedited time frame for achieving permanency through reunification, through adoption or guardianship is crucial. It is also vital for young children to receive interventions for developmental delays as soon as possible. Next slide. So when we discuss foster care, we know it is intended to protect the children. However, the very act of separating very young children from their parents and familiar caregivers may put those children at greater risk of developmental delays. Thus, the importance of quickly finding a permanent placement, especially for infants, cannot be overstated. And to piggyback on my colleague Marlo's point around the ACE study, or Adverse Childhood Experience study, at the same time when that study was being done, parallel research on kids' brains was being conducted around the impact of stress on the developing brain. And so it is critical to distinguish between three kinds of responses to stress as it relates to ACE exposure, which are positive, tolerable, and toxic. And these three terms embody the stress response system's effect on the body, not to the stressful event or experience itself. Now, the three terms, so for instance, positive stress, which is normal, it's an essential part of healthy development, like getting a vaccine or attending the first day of school. Tolerable stress, of course, is a response to a more severe stressor, but might be limited in duration. A more relevant example would be the loss of a loved one, particularly due to COVID-19. And then, of course, toxic stress, which is experiencing strong, frequent, and prolonged adversity, similarly to physical or emotional abuse or exposure to violence. So when children are overloaded with these kinds of stress hormones, they are in flight, fright, or freeze mode. And it is very difficult to learn, and often children are unable to. They often have difficulty trusting adults or developing healthy relationships with their peers. However, I want to emphasize here that this is an appropriate adaptation to their environment. We can expect for changes to happen in children and families amid COVID as they seek to adapt as best as possible, given the input of all the surrounding stressors. So you might see hypervigilance and hypersensitivity in children and in parents in response to this current crisis. Next slide. So I just want to acknowledge that right now, all of us are experiencing our body's responses to the stress around us, from children to parents to teachers to home visitors to policymakers. Though I must say for parents, it might be even more difficult. Being a parent can be a very rewarding and joyful experience, but being a parent can also have its share of stress. And parenting stress and compounded stress, particularly in the midst of a crisis, is overwhelming, especially as it relates to the pressures and stressors that are placed on parents personally and in relation to their children. To mention what's more related to the ghost in the nursery concept, caregiving we offer as parents is heavily influenced by the caregiving we received as children. With all that is happening, we may find decreases in our ability to self-regulate and increases in our vulnerabilities related to experiences that we had during our own upbringing. Not to mention, this is coupled with several other stressors like unexpected events or switching to telework or not being able to telework or not being able to soothe a crying child. There might be relationship challenges or feelings of isolation and loneliness, though it is imperative to understand the impact all of this can have on children as well as foster parents. Next slide. And so I bring that up about the impact of stressors because I can't truly talk about the impact of stressors without also talking about the impact of racial trauma, without also talking about racial equity. I must acknowledge that federal and state policies can create crucially important opportunity to support the developmental needs of infants and toddlers who have experienced maltreatment and or are in foster care. And there are many policies and practices that states can deploy to address the urgent needs of infants, toddlers, and their families particularly families of color. However, we know that oftentimes the process for policy implementation and getting those on the ground oftentimes can be slow moving. In previous work in state government, I had the opportunity to focus a lot of my energy on discussing racial equity, and I provided two definitions where when we often talk about equity or race equity specifically, we often use the definitions that you see before you. So being able to actively engage with partners to identify disparities, to be able to amend policies that might also cause us to amend funding as well. So I want to point out, since joining 0 to 3, I'm happy to see how racial equity is an area where we are placing a lot of focus on, particularly in the Policy Center. And infancy and toddlerhood specifically are important when it comes to focusing on policies that impact young children, because those are periods of incredible possibility and opportunity. Children grow and develop more rapidly during the first 3 years than any other time in their lives, but the odds are stacked against infants and toddlers of color. Despite comprising a large share of our young child population, they disproportionately oftentimes lack resources that help their children or help children and their families thrive. Next slide. So we know historically, child welfare systems across the U.S. have oftentimes lacked sufficient funding, which to my earlier point about policy linking to the reorienting of funding or allowing funding to be increased or moved. We know that across the U.S. there has been a lack of sufficient funding to provide robust prevention services to families with children who are at risk of entering foster care, particularly as it pertains to the potential impacts that it can have on children of color. With roughly half of today's infants and toddlers being children of color, it is important to note that each year our nation grows more and more diverse. Though I want to highlight that I'm hearing from folks that it is seemingly difficult to gather disaggregated data around COVID cases in some states, which of course we use data to inform policy. The data is there, or the data is there, is just often difficulties with retrieving to determine its impact on particular communities. And although research tells us infants and toddlers of color face significant disparities compared to their white peers, we have to also consider this current crisis against the backdrop of what we already know, which is telling, that this pandemic has highlighted and shined a light on several of the disparities that existed long before COVID-19. Overall, children of color are more likely to live in families that may have parents who aren't earning a living wage compared to white families due to structural racism. And when it comes to other related outcomes, due to structural disparities, we see families of color are more likely to be food insecure and to live in poor quality housing and have families that struggle to cover basic needs. Moreover, the stressors associated with not earning a living wage are compounded by challenges accessing preventive health care, accessing high quality child care, as well as accessing interventions for developmental delays and mental health issues for children. Next slide. I would be remiss not to mention that nearly 3 million children under the age of 3, about 23% of all infants and toddlers, are members of an immigrant family. A large share of infants and toddlers in immigrant families are also children of color. In addition to the structural barriers that confront other children of color, children in immigrant families face unique systemic challenges tied to their parents' immigration status. And these burdens are more significant for mixed status families who face persistent fear of family separation due to enforcement actions against undocumented members. Undocumented immigrant parents have higher levels of poverty and are more likely to work in low-wage jobs, often under exploitative conditions. And also research suggests that children in immigrant families are less likely to access public programs that we know can support their development, such as nutrition assistance and early care and education programs, despite infants and toddlers generally being eligible to receive these services as U.S. citizens. Next slide. So experiencing instability and hardship, particularly during the earliest years of life, has long-term consequences for children's and parents' well-being. As you can see on the graph, the impact of losing an infant. So when we talk about infant mortality, you know, reorienting the way that that impact can have, or the effect that it can have on a family if you lose that infant to COVID, or that child's big brother or big sister loses their new baby sister or new baby brother. Not to mention children lacking critical supports like insurance early in life are at higher risk of poor health and developmental delays in childhood. So I'm going to, you know, turn it over to my colleague to talk a little bit more about the impacts that these kinds of things can have even further on child well-being as well.
Thank you, Lee. So Marlo, what can we say about stressors from COVID-19 and child well-being?
So Lee and I have mentioned a couple of things a couple of times, and one of them is that there was a need to look at all of these situations for families who are at risk of entering the child welfare system or who are in the child welfare system even before COVID. But we know that COVID is exacerbating every one of these situations. So if you could go to the next slide, I'm going to take just a few minutes to focus on this topic. So you can go ahead and go to the next slide as well. This slide touches on some of the key ways we know that COVID is impacting young children and their families. And again, as it relates to the child welfare system, the things that I'm going to talk about are things that we're concerned about that may cause more families to unnecessarily end up involved with the child welfare system as a result of the COVID-caused stressors. So as you listen to this, I hope that you'll think about how you can use the information in your states to think about how to restabilize young children and families who've been impacted by COVID-caused stressors to make sure that we don't have a growth in child welfare systems across the country. The first bullet point mentions racial inequities and injustices, and Lee really covered that, so we agreed to put it on this slide as well to keep it in front of you so that you understand as I am talking about each of the other points on the slide, that Black and brown children and families experience each one of these things to a greater degree because of systemic racism. Pregnant and new mothers. According to the CDC, pregnant women are at increased risk for severe illness if they were to contract COVID-19 and at increased risk of adverse pregnancy outcomes if they contract COVID-19. There was a study in Canada that indicates that pregnant and new moms are experiencing stress and depression at much greater levels during the pandemic. Mothers reported their pre-pandemic depression level at 15%, and then it jumped to 41% during the pandemic, and high anxiety jumped from 29% before the pandemic to 72% during the pandemic. Given what Lee shared earlier about young brain development, trauma, and stress, this is very alarming information. We know depression and anxiety for pregnant and new moms are associated with increased risk of preterm delivery, reduced mother-infant bonding, and delays in cognitive emotional development of the infant that can persist into childhood. Prevention and treatment of maternal anxiety and depression is critical, yet it's estimated that only 50% of women who are depressed remain undiagnosed during and following pregnancy. So I want you to imagine what this means for nearly every infant born around the time of or during the pandemic. Simply because of COVID stressors, a vast majority of our babies are at increased risk for developmental delays, the negative impacts of maternal depression and other adversities. In the area of early childhood development, given who you all are, you've probably seen a lot of the effects of COVID up close and personal. Excuse me. Lee's information provided the backdrop for what's going on with early childhood development. And so we know that there is trauma to young children when they are separated from loved ones like caregivers, grandparents, and other loving adults in their lives. And that trauma and that stress affects brain development. And that their parents are isolated from others who can help them during times of stress or illness, which increases the parent's stress, which is concerning. And often that parents don't know how to meet their young child's developmental needs and learning needs, so being isolated means the child can easily fall behind. Then we think about an increase in risk, particularly for essential workers and their families, as they are more exposed to the virus. And so we think about them as potentially being a group that becomes more susceptible to becoming involved with the child welfare system if they don't have the fundamental supports available that will help them stay together, like food and paid sick leave and health care. So at St. Francis Ministries, one of the things that we do is provide direct services in support of children and families. And so I turn to my colleagues to learn from them some of the ways these stressors are being seen in our work. So I want to share a story that brings the intersectionality of the loss of job, loss of income, and substance use disorders. So we were working with a single mother who gave birth to a second child and was laid off during her maternity leave because of COVID. She was on a successful road to recovery from substance addiction and had her children in her home with her, and our program was helping them stay together. Because of COVID, one of her required drug screenings was not possible because of social distancing, so she relapsed in her recovery, and then she didn't show up for the planned placement of her family into a family-based residential substance use treatment center. She ended up sending her older children to live with the grandparents, and she turned the new baby over to the father, and as a result, now both of her children have been placed in foster care. And her story is being repeated over and over across the country. So then when we know young children are in the child welfare system at this time, we know of some of the things that they are dealing with. Birth parents, because of social distancing measures, birth parents whose children are in foster care, but they are on a path for reunifying with their children, they've not been able to have visits that help keep them connected to children, which we know affects the child attachment and bonding. We spoke earlier about self-regulation and how young children have to learn how to self-regulate. And so we're seeing children in child welfare have behavioral skills that are declining because social workers would typically have done interactive play therapy with them in person. And that kind of therapy with young children is very difficult to do virtually. But we also have seen some positive developments, which are good to think about, because what are the kinds of things that are happening that we can build on during the pandemic and also build on beyond the pandemic, just to improve overall. So one is that social workers have been able to spend more time with families because they're meeting with them virtually, so they don't have to spend as much time on the road traveling from house to house. So they're providing a larger quantity of parent skill building to parents of all types, birth parents, kin caregivers, and foster parents, which is really helping mitigate some of the things I talked about earlier. When parent skills are low, if we can give them a high dose of parent skill building during this time, it can be very helpful. And the other thing is that there are family preservation programs that are used in the child welfare system to help keep families together to try to prevent their children from entering the foster care system. And we use one of those programs at St. Francis. It's family-centered treatment. And I was just on the phone earlier with the Arkansas Director of Child Welfare, and she was just saying that the use of the family preservation programs in their state right now is being so tremendously helpful to stabilizing families in the time of COVID. So I think we're seeing a program being very useful in time of the pandemic, and also recognizing that as family preservation programs like this one could be used for families before they get into the child welfare system, that could be very beneficial to ramp that up right now to help make sure that we don't have families end up in the child welfare system because of COVID. And I know Dr. Shropshire is actually going to talk a little bit about those kinds of strategies in just a minute. However, I will say that as of last week, we know that states are starting to cut the funding for those effective family preservation programs because state revenues are low because of COVID. But we know the adage, you know, it's penny wise and pound foolish. They're cutting those programs now, and if that results in more families going to the child welfare system, it's a lot of heartache for families and a lot of cost and burden on the system. So we're concerned about that.
Thank you, Marlo. And thanks for also including a couple of positive opportunities that this most difficult time presents. So Lee, let's come back to you and ask you to talk a little bit more about infant and early childhood mental health in these difficult times.
Thank you so much, Marlo, for again naming those areas that we're seeing the impact of COVID, and also some strategies. But I also want to talk a little bit about just one thing that we often hear, which are myths as it relates to trauma, right? So one myth that I want to often address that I hear is a common misunderstanding that I've heard related to the impact of trauma on children. The myth is that children are too young to be impacted by trauma or traumatic events, since they do not understand traumatic events. Therefore, it's better if we do not talk about it with them. However, the fact is young children are adversely affected by traumatic events, even though they may not understand what happened. Young brains are particularly sensitive to stress-inducing experiences. And I just want to point out, you know, as I mentioned before regarding racial disparities, you know, we're seeing increasing numbers of Black people in particular that appear to be dying more often due to COVID-19, with this same trend being observed in major cities. And what these cities also have in common, to Marlo's point, is the response from states. And oftentimes, as it relates to COVID, usually you've seen police involvement, there have been fines, there have been incarceration, there's been slashing of funding for programs, in some ways, other ways to enforce social distancing or physical distancing. So you do oftentimes have Black individuals, especially those who do not earn a living wage, who are at greatest risk of death and encountering criminal penalties associated with the pandemic with the least resources to fight. And it is because of structural racism, which we know oftentimes put us put Black individuals like myself in more forward-facing jobs, so that we are more exposed to COVID-19, which makes it very difficult for communities to be able to thrive. And I did want to say in this moment, Marlo, if there were other examples that you heard in terms of myths or things that you wanted to highlight, I did want to offer that up to you.
Well, I hit on some of them, but I think, you know, some of the things that we know are that children, and you've kind of touched on this too, children don't have the experience or the kind of the maturity, the development to cope under strict circumstances. So we know that that overwhelming stress that they're feeling when they can't go outside, when they can't see their grandparent, when they're told, no, you can't do this or that because of social distancing, they can't understand what that is, but they still experience the stress from that. And it's harder for them to have coping skills like adults or older children, teenagers might have and been able to develop. So this disrupts brain development. And then the other thing, and I know any child care providers on the phone who's been providing care continuously through the pandemic knows this one probably all too well, but that young children have difficulty keeping masks on and practicing social distancing. So we can imagine in settings where young children are it's really vital to their health and others that they keep the mask on, that they keep their distance, that there's an increased level of stress among the adults in the room with the child, which the child feels and internalizes because they're, constantly put your mask on, or be further apart from your playmate or your grandparent or whoever it is that you're in the room with. So that's also a stress that we may be dealing with for a long time.
Mm-hmm. Thank you so much. Next slide. So, to that end, even though children are sensitive to these stressors and to these stress-inducing experiences, their age works in their favor to some degree. As you can see on the graph, and this is a graph that was developed from the Center on the Developing Child at Harvard University, that it is easier and less costly to form strong brain circuits during the early years than it is to intervene or fix, quote unquote, them later. So with this in mind, it is important to understand what our little ones are often up against, even with their ability to change in response to experiences. Next slide. So with that said, at 0 to 3, when we talk about infant and early childhood mental health, this multidisciplinary field and its related policies that we are often tasked with educating staffers about, which in my role, going to the Hill and having conversations about it, we're usually talking about policies that seek to ensure that there is access on a practical level to a robust array of supports and services for families across this full continuum of promotion, prevention, developmentally appropriate assessment and diagnosis, as well as treatment. So when we think about what families deserve access to within the realm of clinical practice, particularly as I often talk about this to staffers, we orient ourselves to this particular continuum and how a range of services could support families across this continuum as they are managing the different kinds of stressors and trying to cope with the different kinds of stressors. So you might find that there are already promotion services near you that support social emotional wellness by encouraging parents to talk to and play with their babies, or encouraging parents to complete social emotional screenings. There are prevention programs that can support families. We often think of things like home visiting or mental health consultation. And then there's assessment and diagnosis. So of course, when I talk about things like mental health consultation, we know in the age of COVID, clinicians have had to become creative. Consultants have had to become creative, whether it's by using virtual methods or telemethods or coming up with other kinds of strategies to be able to support families as they're undergoing these new kinds of stressors. Even when it comes to treatment, where treatment programs are designed to alleviate the stress or distress and suffering of infants and young children's mental health problems and support the return to healthy development and behavior in policies that support these services. So when we talk about treatment, we talk about something that often isn't said, is that children can and do experience mental health problems. And so to be able to support them in the realm of COVID requires reimagining the ways in which we support children and families. It requires us, as we continue to move forward, to think about a better normal. And one example, and I know Marlo is going to speak to this. One example is I had a parent that was sharing with me, just how has it been navigating visitation between her and her partner, and what it's been like for her toddler to want to see her dad, but then the mother has her mom living with her, so she is said to be in the high risk category, so thinking about how do I navigate wanting my daughter to see her father, but also wanting to keep my mother safe. And so implementing strategies using FaceTime and figuring out ways where they're communicating using technology to be able to work around those kinds of visitations. And again, you'll see that oftentimes states have had to have conversations about how do we do this kind of visitation, because the father believes it is in his right to hold his child. It is in his right to see his child. So thinking about the impact that can have when it comes to nurturing those important relationships where development, and particularly brain development, is most critical. So I'm going to turn it over to my colleague, Marlo, to talk a little bit more about what we mean when we say a better normal.
So lots of people are yearning to return to normal, and some are talking about as a new normal, but we want to really urge you to think about how can you take steps now to have a better normal. So how can you work to make, in this moment, to make long-lasting improvements? So we've come up with a set of key recommendations for you to consider to kind of offer some hope and some innovative thinking going forward. And first, we'll say these times make it necessary more than ever before to bridge the early childhood system and child welfare systems into a connected unit. And we have two leaders from Oklahoma who are going to share their story about how they are making that happen. So you can go to the next slide. We have Executive Director of the Oklahoma Partnership for School Readiness, Debra Andersen, with us, and she has expertise in early childhood development, the early childhood system, and in organizing collaborative efforts at both community and state levels to create positive change for young children and their families. And we have Dr. Debra Shropshire, who is the Director of Oklahoma DHS Child Welfare Services. She's a pediatrician and has done quite a bit of work in child welfare, in foster care. In fact, has received a number of state and national awards for her work in preventing child abuse and neglect. So I'm very excited to turn it over to Dr. Shropshire and Debra to share their story.
Yeah, thanks everyone for just allowing us to jump on and talk a little bit about Oklahoma. My name is Deb. I'm a pediatrician, and it's kind of funny because I don't really like children all that much. So I'm glad for all of you who are on the call who do, but I really did fall in love with kids in foster care. And that led me into the field of pediatrics and ultimately into the opportunity to serve as a leader in the child welfare world. I think this is a very timely conversation, and we look forward to unpacking a little bit, I think, about some of the work we've been doing in the early childhood space and partnering really with Deb Andersen and the Partnership for School Readiness. And Deb, I'm going to turn it over to you to continue to introduce yourself, but also to really talk about from your perspective what that collaboration has kind of looked like between child welfare and early childhood.
Great. Thank you, Dr. Shropshire. And thank you also, I just have to give a shout out for your leadership and vision in Oklahoma in recognizing the distinct needs of young children in the child welfare system. I think your background as a pediatrician definitely gives you an edge and gives Oklahoma an edge with that perspective that you have, and that you believe in the opportunity to believe in the potential of all families. And so we've really valued our partnership and working with you. I also want to thank Marlo for her patient persistence in supporting Oklahoma's efforts to engage in meaningful dialogue around this collaboration, and her knowledge of both the Family First Prevention Services Act and the Preschool Development Grant, which has really helped us guide our thinking on how these two plans can and absolutely should align. My organization actually exists because of Marlo's vision nearly 20 years ago, that we can build better early childhood collaboration in our state. Today, the Oklahoma Partnership for School Readiness serves as Oklahoma's Early Childhood Advisory Council. Finally, much thanks to the Build for this opportunity to highlight how critical this collaboration is and give us a chance to share our experiences in Oklahoma. It was really critical that we plan together prior to the pandemic, and even more so now as we heighten our focus on ensuring racial equity in response to the impact of COVID-19. This isn't my first Build webinar in this series, and the opportunity to focus on racial equity throughout this series couldn't be more relevant than during these times, so appreciate that. I'm briefly going to outline the process that we use to create a bridge by creating intentional opportunities to bring both systems together to create some well-informed plans. Unfortunately, Oklahoma did not receive the renewal funding for the preschool development grant. However, all of our stakeholders have remained committed to continuing the valuable work that we started with the planning grant. And while funding certainly helps, the cost to jointly plan and implement effective practices is very small compared to the benefits. And so that's whether you have a lot of funding behind this or not, that's what I want to encourage you to think about and share a little bit about what we did in Oklahoma. Next slide, please. Under Marlo's guidance, we began with a small work group that informed the development of the Preschool Development Grant Strategic Plan with some strategies that were specific to the child welfare population. This work group participated in a data walk and strategy development, specifically to think about secondary prevention activities to reduce child welfare involvement. After the plan was submitted, we began planning for a deeper discussion with a broader audience of stakeholders in order to build on the preschool development plan and to inform the development of Oklahoma's Family First Prevention Services Plan. We hosted a virtual convening in May. It was originally going to be face-to-face and the pandemic hit. So it took us a bit to regroup and replan. During that convening, we welcomed over 100 participants from very diverse backgrounds in child welfare and early childhood. And I wanted to mention, Lee, we also regularly collaborate with a number of infant mental health specialists in Oklahoma in the planning work that we do as well. So thank you for your comments on that. During this meeting, a panel addressed the continuum of need and research to better inform our audience on the intersection of our work. Following the public presentation, we invited key stakeholders to participate in breakout rooms. We learned a lot about Zoom in this process, to provide recommendations to ensure that the distinct needs of young children across the continuum of prevention and treatment are addressed in Oklahoma's Family First Plan. Results from my perspective are that we developed a great ongoing collaboration with our Child Welfare Division at DHS. Keitha Wilson, who is the lead under Dr. Shropshire's leadership for Oklahoma's Family First Prevention Services Plan, has joined as an active member of the Preschool Development Steering Committee. And that's a representation that was lacking in our previous state level systems planning. I've also become a member of the steering committee for Oklahoma's plan. So we're doing a lot of cross-pollination, I guess, if you will, of our talents and making sure that we're staying connected. A couple of recommendations from the convening. One that was really important to us is to do a better job of lifting family voice into policy decision making. We are exploring and are going to talk to our governor about adding at least 2 parents with child welfare experiences to the Oklahoma Partnership for School Readiness Board. That will require governor appointment, which also provides us an opportunity to highlight this collaboration with our governor. We also want to reduce fragmentation for children either at risk of or involved in the child welfare system by exploring how we can build better coordinated enrollment to really create a better continuum of care. Where Dr. Shropshire was particularly concerned about those children and families that are referred but screen out. And so how do we stay connected with them with a strong support system so that they don't later perhaps need to have some child welfare involvement. We had many more results from the meeting. The presentations from our convening and our next steps are available on our website, and we'll make that available to build so that that can be posted with the recording of this meeting following that. So Dr. Shropshire, I will turn it back to you to talk more about strategies under development and what we're seeing in Oklahoma as a result of the pandemic. Thanks so much.
Yeah, absolutely. So, and just because I know that many of you on this call are more from the early childhood space, let me give you just a little snapshot of kind of what, some things about child welfare that I think are important for us to sort of think about. One is that the primary pillar goals of the child welfare system are safety, permanency, and well-being. But what you may find in many of the places where you are in the child welfare system, so much of the focus is on child safety, physical safety, and it's also on permanency, meaning either returning children home or moving them to a permanent family and ultimately not having them in the foster care system for long periods of time, that often well-being sort of becomes in as the third wheel. And also what is sometimes not always well understood or played out well in the child welfare system is the idea that physical safety does not mean you're safe, that there is a mental and emotional toll on whether it's the trauma, as we heard talked about earlier, that's happening in your own home, or whether it's removal into the child welfare system. Those things take a toll. Just because we think you have a roof over your head and food to eat does not mean you are safe. And so I think really we are trying to push the child welfare system here in Oklahoma, and I know some other states are doing this as well, towards the idea of flipping those priorities and saying well-being should be the top priority, because well-being also encapsulates safety and permanency, having permanent family. And if we can do that, then it allows us to think broader about what else children need that we encounter. In our particular system, and I know earlier was talked about the idea of how many how many children are in the system because of neglect. In Oklahoma, it's between 80 and 90% of the children who are out of their family homes in foster care because of neglect. That's crazy. We have to figure out how to strengthen and support families on the front end, whether it's through primary or secondary prevention efforts, or even those families that are encountering child welfare. We have to figure out how to strengthen those families so those children don't experience the trauma of removal, or if they do, that there's a point to it and there is a sort of a direction that we're trying to go with it. Well, COVID is, as you can imagine, wreaking havoc on a lot of that. I have a deep amount of concern about the loss of face-to-face interaction between whether it's providers or parents and children, or even my own staff with parents. And so like all states, we have modified the way that we do our business, but we're doing the best we can to fight for continued face-to-face contact where we can, and the creative use of virtual contact in those spaces that we can as well. We also, just for context, almost every single child welfare system in the country during COVID, so starting in March to April, experienced about a 50% decline in the number of phone calls coming into the child welfare system. This is very concerning because it reflects the fact that children are not out in the community, where people in the community are able to see what kids and families need and able to at least contact somebody for assistance. We don't know what will happen going into the fall with schools variably making decisions about return, but we have deep concerns about, in a sense, what families need and how to get to them. In a time when the number of even alerts to those of us, whatever system you're sort of in, those number of kind of alerts or signals to us are reduced. So we're trying to imagine, how do we, in a sense, outreach families? And one way we could do that is through thinking about how we connect families who we come in contact with through even screened out referrals or other ways that aren't children that need to be in the foster care system, how we can connect them with community resources to help strengthen those families, and not just imagine waiting until a child needs to be in foster care and is in danger before we intervene. We're also trying to imagine how to do better partnership with our early childhood systems so that we can preserve and protect the brain development, the important train tracks that are laid down in those early years of life, between 0 to 3, 0 to 5, and get kids kind of in the right direction for what we know will be a lifelong impact, positive or negative. A lot of that's on our shoulders. And so I know that some of you are in states where You may or may not have had a ton of direct relationship with your child welfare agency, and your child welfare agency, honestly, very well, in some places, maybe just trying to deal with what they have to deal with, which often, again, is child safety and foster care and adoption. But I would just encourage you in that there's a number of states that actually are pushing into the prevention space, are pushing into the brain development, early childhood health, well-being space, and that COVID actually presents a unique opportunity for you to reach out to your local child welfare leadership and say, hey, we should be partnering right now because you're fixing to get overrun. Frankly, every child welfare agency in the country is worried about being overwhelmed. And so it's a great time to offer help. And when you offer a little bit of, sort of how can we work together, a crisis like this often opens the door for that in a way that maybe other times don't. So I would just encourage you to take advantage of the crisis to kind of make some new friends. So I'll stop with that.
Absolutely. We appreciate that. And I just personally have to echo your thoughts about the importance of well-being relative to safety and permanence. They really are flipped around backwards. And I think this is an important time, where we can try to make that case that relationship between those three key pillars of child welfare need to be flipped. So can we move to the next slide?
Yeah,
Okay,
so I'm just going to, I'll talk just
Marlo,
for a few minutes. Thank you. We want to leave you again with some recommendations. So our first is, and Dr. Shropshire said it great about early childhood system leaders need to go and be in touch with the child welfare leaders, and now is a great time. Second recommendation is to consider the distinct needs of children and families who've experienced trauma and adversity. Again, this is another thing that's always been true, but is especially true now. And really, all early childhood and child welfare systems need to become trauma-informed and trauma-responsive. So if your state isn't already doing that, it's time to insist on that. Another recommendation is to be the voice for the distinct needs of young children. It's particularly important for early childhood leaders who have that knowledge, who have that direct experience with children, to really lift up the science that Lee brought and talked to us about today, because it makes it perfectly clear to us that there are distinct needs that young children have that need to be addressed, but it, as Dr. Shropshire said, it often can take a back seat. And so there need to be advocates for that, and early childhood leaders are great for that. A fourth one is to design family-centered strategies that respond to mental health and substance use disorder needs. So we think that the needs are going to increase because of COVID. So again, it's a really important time to think about how to address that. On the next slide, you'll see a fifth recommendation is that to ensure that providers can recognize and respond to the trauma and build resilience. So this is early care and education providers and teachers, as well as child welfare staff and social workers, to train them in the trauma and resilience science. And then the sixth one, I want to really encourage people to be aware of this. So in the last federal COVID bill, the CARES Act, quite a bit of flexible federal funding went to the states. And even though we don't know what the next federal COVID bill will bring, we should know any day now what the Senate Republicans are going to propose, which will begin to help us see what might be possible. But what we have heard is that there is a leaning toward getting flexible funding to the states. So we just encourage you to watch for that, be involved in it, and think about how could flexible funding be used now to address COVID, but in ways that are durable and will have long-standing influence on the systems. So that it's a great time to be thinking about that. Our seventh tip is to encourage focus and planning for effectively restabilizing families living with pandemic-induced stressors. So if you think specifically of that group as a population that has specific needs, to try to plan now for them, again, to prevent them from ending up in the child welfare system. And then the eighth is to be concrete with strategies to ensure race equity. Every step of the process you undertake to achieve a better normal, if you insist on strategies that address racism and racial inequities, it's an important conversation that you can be the person who brings it up and insists on the disaggregation of data, and the strategic conversations that can be had about how to reduce racial inequities. So those are our tips, and I think I'm going to skip my next slide actually to give Lee a couple of minutes. I know he has some things he wants to add.
Great, thank you. Lee, you want to talk a little bit about policy with us now?
You know, so with the previous considerations in mind, and I just want to say that I appreciate both your colleagues for speaking about their example. You know, in my current role, I am working on talking with Congress about infant and early childhood mental health priorities, what they can do for families, and some ideas around what we are asking, and to highlight just why these are important areas of investment. So we all know when COVID-19 hit the world in the way that it did, particularly in the U.S., not only did it shine a light on several of the disparities that already existed with COVID, but we liken it to a tsunami, or liken it to an earthquake. So like an earthquake, you know, there is all of this destruction and all of the stuff that goes on, but what we often forget about is the tsunami that follows, and the people that are impacted are the ones that cannot get to higher ground. And so we know that with the pandemic, we understand that folks will be disproportionately impacted by it, and thus 0 to 3 has developed legislative recommendations that we've called critical needs for babies to protect them during the COVID-19 pandemic. And these are the 5 critical areas, which are sustaining childcare and other learning, early learning supports, to ensure economic security, to support strong families, to support strong social emotional health, and to meet basic needs for health and well-being. And again, I can talk, you know, if anyone has questions about, you know, the meat and potatoes, so to speak, of what those look like, ultimately, we can talk a little bit more about that too. But I just wanted to highlight that these are important areas of investment if we are hoping to curtail what we already know are going to be impacts by such a pandemic and such a crisis. But we have to acknowledge that if we're going to be able to support the childcare workforce, if we're going to be able to support strong families, there has to be something done from a legislative level, from a policy level, to be able to ensure that families, if they cannot make it to higher ground, that they can weather the storm in a way that means that that they will be able to continue to support one another until there are adequate supports and services. So next slide. I want to say I would be remiss for not mentioning that this entire presentation is really about, you know, the theme of strong connections that help buffer adversity. I cannot overstate the importance of nurturing experiences. I cannot overstate the importance of relationship. I cannot overstate how nurturing early experiences really do get under the skin, and how those connections help buffer adversity. Here at 0 to 3, we have a national infant toddler court program that's funded through HRSA and through their maternal and child health division, and we are working with over 100 sites in 29 states currently with our national infant toddler court program. And the purpose of that program is supporting wide-scale dissemination of the Safe Babies Court team approach. It is a specialized support for children birth to 3 years of age in foster care or at risk of removal and their families. This evidence-based approach connects babies and their families with the support and services they need to ensure healthy development and lasting permanency. And one thing I will say about this particular program is that it ensures that there is an evidence base for infant toddler courts, since we know that there is going to be some sort of interaction with the court system, that we cannot prevent a lot of the impacts that children will inadvertently feel by having to undergo the court system. So there's things that we may not be aware of that they may be experiencing by encountering the court system for the first time. And so having individuals who are specialized in trauma-informed care, to Marlo's point, we can advance the ability to address parents' past trauma and immediate service needs. Also, to be able to strengthen child welfare practices and early childhood systems to support the parent-child relationships and to optimize the well-being of infants and toddlers in the child welfare system. Also, to be able to promote the spread of evidence-based infant toddler courts to other jurisdictions, hence why there are, right now, there are 100 sites in 29 states currently, and to promote the implementation of two-generation trauma-informed evidence-based early interventions in the court and child welfare systems and across child and family serving systems. So again, it really is important that I highlight this resource that will also be something that you all can tap into following the presentation as a means to be able to ensure the healthy development and lasting permanency for young children who are facing the child welfare system.
Thank you so much for that. And we want to allow we've got a few more minutes. We got about 5 minutes until we close, but we would like to hear from you in the audience. If you have any questions or comments, to please put them in the chat. We did have one, which was a question about whether someone would like to speak to the importance and significance of fathers when we talk about strong families and building strong connections to support resilience in children, to support their healthy development. If any of our speakers would like to address the importance of fathers and the particular challenges of keeping fathers involved when you have a family whose child is placed in foster care.
Yeah, Marlo, if you don't mind going. You know, one thing I will say to my earlier example about the mother and the father. So it was a non-custodial situation where the father felt that he had a right to see his toddler, to see his daughter. And so it was really by the kindness, you know, really of the mother to compromise, because we know that the systems do not really consider the rights of fathers really pre-COVID. And so now we also understand that that's not often the case when it comes to their rights being prioritized post-COVID as well. And so one of the things that we have to speak about the importance of the father, right? We have to speak about, when I talk about nurturing relationships, there's often not a lot of research that when we say parent, parent usually is referring to the mother, and most research rather than it is referring to the father. But we know that the relationship between a child and their father is just as important as the relationship between a child and their mother. Because again, it goes back to our earlier conversation about building strong connections. Until we have a system that is willing to move from neutrality, you know, into real and sustained change towards equity, until the policies and organizational practices within child welfare are anti-racist, anti-oppressive, and anti-colonial, until there is a visceral interrogation of privilege and power, and a collective commitment to share that power, then we have to continue to speak about the importance of the impact that fathers can have on the lives of young children. And so I cannot overstate that when we say early nurturing experiences matter, that matters, whether it is the father or the mother. And so I just want to speak that fathers are valuable and they are integral to the development of the young child and are important to the family, being that oftentimes even having fathers who are dealing with their own struggles with being dehumanized by systems and by structural racism. So we want to continue to come from a strength-based position when we talk about the importance of fathers being included in the child's lives, and count on them being the experts too when it comes to how they can engage, especially during COVID, whether it's using technology or listening to them about what kind of strategies would be helpful as well. But we always want to continue to speak about the value of fathers for parents.
Thank you, and thank you for expressing that with such great passion. And speaking of the importance of those connections, we have one question in the chat, which is, knowing that having face-to-face interaction supports identifying families' needs, reporting concerns, how do we support our early educators who are underpaid, have families of their own, and might be fearful of returning to the classroom, triggering their own trauma? So that is the question there, timely for sure. Anybody have a quick answer for a very complicated question?
Yeah, it is a complicated question and in a lot of different spaces. I mean, I think consistent guidance, like clear guidance on how we operate in the most healthy way matters. For my staff, they're okay with the idea that we're going to be out face-to-face interacting with folks, but they want to know, do I have the safety equipment I need to equip them with? Do I have clear sort of guidance? Am I generally trying to watch out for their health and not put them, in a sense, in danger? And then how are we providing, in a sense, clinical behavioral health supports directly to our staff? And I think this is true in the early childhood space and the education space as well. We have to see the providers as in need of support, because if you're not supported, then you don't have anything to, in a sense, give the people you're serving. That's also true in terms of even just flexibility with childcare for your own self. We're going to be struggling with our own staff having, schools closing or opening or whatever, and being flexible about how we try to do our work so that we are not putting extra pressure, in a sense, on our staff.
Absolutely. Absolutely. Thank you so much. Thanks, everybody. We really appreciate your attention and your time. Speaking of which, we went a little bit over, but there's just so much to say on this topic. Danielle, I'm instructed to hand it back over to you.
Thank you so much, Cynthia. And really is such a rich topic. Before you all sign off, we do want to encourage you to give us some feedback on today's webinar. Some poll questions I think have just popped up on your screens, and also let us know in the chat box what was useful, significant, or new, and how we could improve the webinar. I want to thank our session leaders today for this interesting and informative opportunity. We appreciate the contributions from our participants in the chat box as well. Thank you, and have a great day.